Hello and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And today I'm with Crystal Karges. Welcome, Crystal.
Thank you so much, Kristen. I'm so glad to be here.
It's lovely to have you back here at Gold. You are, of course, part of our Gold Midwifery Conference 2026. And we get started just in a little while from now. We were just talking earlier. It's just around the corner, and our opening keynote presentation will be February 2nd. That's an open access keynote presentation. But Crystal, you are coming with us with a very special topic titled Eating Disordered in the Perinatal Period, a Hidden Crisis in Maternal Care. I want to talk about that in just a moment. Briefly tell us about your background.
Sure. Thank you so much. So, I am a registered dietitian, nutritionist, and also an international board certified lactation consultant, and have a private practice that specializes in maternal child health. But over the years of practice, I started kind of narrowing down more to supporting women during the perinatal period, specifically women who are recovering from some form of eating pathology, disordered eating, eating disorders, and especially as I could anecdotally see the significant impact that this was having on them during their pregnancy or postpartum. So, this has become a passion project, and I'm just so
Mhm.
excited to be here and share this with all of you today.
Fantastic. In your title, you have you're calling it a hidden crisis, eating disorders as a hidden crisis in maternal care. Why do you think eating disorders remain so under-recognized during pregnancy and postpartum?
Yeah, this is a great question. Well, I think there's multiple different reasons. One being is that we don't have a universal screening tool. So,
Mhm.
unlike gestational diabetes, where there is universal screening and it's a pretty standard part of perinatal care, there isn't anything like that for eating disorders, even though the frequencies of eating disorders in pregnancy is relatively comparable to that of gestational diabetes. And that's what we see in the literature. Also, there's a lot of behaviors that are associated with eating disorders that often mimic normal pregnancy experiences. So, for example, uh, vomiting or purging, which is a behavior, an eating pathology that we might recognize in a non pregnant person. However, that could be a totally normal experience of a woman who is pregnant. So, the overlapping pathology and pregnancy symptoms can make it tricky to distinguish what's really happening there. There's also a lot of stigma around eating disorders, which can make it very difficult for women to feel like they can openly talk to their providers about it. And so, when we are more informed as providers about red flags and what to look
Mhm.
for and how to discuss these concerns with our patients, then it's something that we can hopefully identify and intervene with sooner.
You talked about just now about conversations, right? So how can midwives initiate conversations about food and weight and body image in a sensitive way, in a non-stigmatizing way? It is sometimes, not a topic that if we start off on the wrong foot, if we start off wrong, I feel like we can do a lot of damage, and our client might be clamping up and not voluntarily giving us information. So what would be a good way to start a conversation?
Yes, this is a great question. And it is hard. It's a very sensitive topic. And I think there's multiple different approaches, but one is just approaching it from a very curious and compassionate lens where we're not assuming that we know everything, that we're really interested in understanding our patient, their perspective, what they might be struggling with. And so I think when we can come in with that compassionate voice and also asking open-ended questions from a very curious lens, making observations without judgment. Like I noticed that your weight trajectory is just not progressing in the way that we would hope for during your pregnancy. Can you tell me maybe what your eating experiences have been like for you? And we just create an open space that is safe for our patients to be able to hopefully feel like they can confide and trust in us by sharing maybe some of their journey with us. But I think trauma-informed interviewing techniques can come into play here in a very significant way in order to help our patients feel safe with us with this sensitive topic.
Now, if we suspect we have that conversation and there is a eating disorders, what can midwives do? I think, some midwives might feel this is out of scope. I feel like overwhelmed. Yeah, I have some degree of nutritional education, but not to the extent. What are some processes should I refer? So what do you suggest as the first kind of steps?
Yes. Well, I think it's really important to say that eating disorders and the treatment of eating disorders are interdisciplinary in that it requires collaboration across disciplines because they are so complex. They require really working with psychology, family systems, nutrition, right? So there's a lot of different intersections here. That being said, I don't think it depends all on the provider to be able to root these things out. Really, what we're looking for is that pathology, early warning signs, so that we can help with referral and support earlier. So I think that's an important distinction to make is that we do not need to diagnose. That is not our job. We want to be screening. Just like with gestational diabetes, the
Right.
first step is always screening. And then if someone tests positive, then we refer them kind of to the proper sources for ongoing assessment and treatment. So similar things that we're just kind of screening for some of those red flags. And then to be able to build kind of your own referral network. So ideally having in your referral system dietitians, psychologists, other maybe psychiatrists that do specialize in eating disorders so that you can make referrals to those providers for further assessment and treatment if you are flagging that risk or screening for that risk in your practice.
That's great information right there. I feel like you're right. Um, it's very helpful to look at it as just something like just compare it to gestational diabetes because I feel like that gives us a little bit more of guidance. Yes, we know how to work with this, right? Like so we know what to
Yes,
do in this case. So it is pretty similar as such if we approach it in a way of we're not diagnosing, we're screening, and then refer to the proper channels and have some resources available for our clients as
absolutely.
well. That's a wonderful advice there for sure.
Hmm.
And Crystal, before I let you go, what are your hopes our viewers will take away from this presentation?
Yes, well, it's just such an honor to be speaking to midwives. I think, again, we were talking earlier that midwives are really on the front line. And I think midwives often are seeing things firsthand with their patients that maybe other providers would never see. And I think midwives have such a unique relationship in that they're building long-term trust with their patients over the course of their pregnancy and postpartum. And so it's my hope to just increase awareness about a very significant issue that does have clinical risks for both the mother and the baby. And eating disorders during pregnancy are not something where consequences or potential risks stop at delivery. This is something that has implications into postpartum, into child feeding, into attachment with the baby, child development. There's so many implications that extend beyond pregnancy. And so, my hope is if we can increase awareness among providers who are working in the front lines, we can intervene earlier and help support mothers and their families, hopefully for generations to come, because this really is a significant issue and there's just not enough information out there right now for providers.
Well, so well said, Crystal. I can't wait for your presentation, and I'm really looking forward to seeing you soon at the conference.
Thank you, Kristen. Can't wait. Excited to be there.
And now some information for our viewers. If you would like to find out more about Crystal's presentation, go to goldmidwifery.com. You can find out everything there. Yes, we have live presentations, but all our live presentations will be recorded so you can watch it at a time that's convenient for you. We have speaker moderated forums where you can ask questions of our speakers, just like Crystal here. And we hope to see everyone at the conference. Thank you so much for watching. Bye bye, everyone.